Good afternoon. My name's Julie Gange. I'm team leader of industry policy here at Federated Farmers and also a member of the pan-sector industry working group who've pulled this webinar for you today. So today the webinar is designed to offer information on what will be considered when making a decision on whether or not you can stay on farm if there's a COVID positive case or you become a close contact. This is all about you. This is all about the questions that you might have. So just a little bit about the webinar today. The first thing I'll say is that, like everyone else, there are times we can be challenged by technology and there might be a few glitches. So bear with us if there are. We'll try and rectify them as soon as we can. However, this is being recorded and it will be available to the public. So we're hoping to have this up online on the Federated Farmers website and with the other industry working group members, organisations later on this afternoon. So our panellists for today are Dr. Michael Butchard. Now I am going to read this out so I don't get it wrong. Michael's a public health physician and medical officer of health with the Southern DHB, the public health unit at South Waikato Hospital. James Usher is Associate Professor at the Department of Microbiology and Immunology at the University of Otago. He's also a Director at the Webster Centre for Infectious Diseases, a Science Director for Vaccine Alliance Aotearoa New Zealand, or Ohu Kaupiri Huakito, and a consultant clinical microbiologist at Southern Community Laboratories. Pete Wally is the Community SIQ Manager for Southern DHB. Andrew Lindsay may or may not be able to be with us today. He's the Officer of Health based in Nelson. And Emma McIndoe is the COVID-19 Vaccination Program Manager for the Southern District Health Board. We'll start today's webinar with a short intro from myself on what the industry working group has been doing in the background to help farmers. That'll be followed by a brief introduction by Dr. Michael Butchard, and then we'll go straight into questions and answers. If you have a question, type it in the chat box and we'll get to it as soon as we can. If we are unable to answer the question, there will be a fact sheet following this, which will hopefully capture all those that we haven't been able to answer and even some of those more common ones that we have been able to. We'll hope to have that up on the websites in the next day or two, along with a copy of this webinar. So I'm going to start with the industry working group. So the industry working group is as pan-sector as it gets when it comes to getting together. So we looked at what will happen if your farm has a COVID positive case or you become a close contact, and how this can minimise the effect on the animals on your farm, especially if isolation was to occur and you were taken off your property. It's a very real concern, along with your own physical health concerns and the disruption to your business. So back in August, when Delta first raised its head here in New Zealand, Federated Farmers, Beef and Lamb, Dairy NZ, New Zealand Pork, Poultry Industry Association and Egg Growers, with the Dairy Industry of New Zealand and MPI, got together as a group to look at how we could assist farmers to be more prepared and to get through this. So we looked at how we could develop relationships to assist in making those decisions and hopefully facilitate better outcomes for farmers by offering information that decision makers may or may not have, and identify challenges for farmers. So the working group was also about offering farmers information on what decision makers will be looking at and how they could be better prepared. So, I mean, as an industry working group, we're not here to tell you to suck eggs, excuse the pun. Rather, we want to offer concise information and easy to use tools that can help you prepare and make your job easier. To that end, we've been speaking to a number of other organisations, including the Ministry of Health, Rural Support Trusts, Meat Industry Association, Dairy Companies in New Zealand, to name a few. From this, we have created an easy-to-use checklist, which will be available on our websites, hopefully from this afternoon. And in the next week, we're hoping that you'll be able to actually just pick that checklist up from your rural retailer and fill that out. So I'd like to hand over to Michael Butcher. So welcome, Michael.
Thanks, Julie. Kia ora koutou. So I won't take up too much time speaking to you now, but very happy to answer questions. So the reason why I'm on here is some of you may be aware that the role of the Medical Officer of Health, it's in the Health Act and legislation, it's up to that role. And there are many of us around the country, but at least one or two in each DHB. It's up to that role to decide where people isolate if they have COVID and the management of the close contacts. I'll just say at the outset, while it used to be the case that it was expected that every case would end up in a managed isolation facility, for a start, Southern doesn't have a managed isolation facility, and many other district health boards don't. And also there's a general move across the country that cases will actually be isolating in their homes. So that shouldn't be a big fear for people. I understand that there'll be questions around isolation, both of cases and contacts, what sort of work you can and can't do on farm. So happy to hear those sort of questions. While the decisions that I'll make will be only in relation to Southern District Health Board, there is also a national response. So all public health units across the country, there are 12 of them, working, supporting Auckland, and if this outbreak spreads further, and it has into Northland, Waikato, Christchurch, the public health unit and the Medical Officer of Health that might make decisions for you may or may not be from your local region. When we make decisions, we have a risk assessment approach, and I'll be trying to go through some of that with you when you ask questions. So I might give a general response rather than getting too bogged into the individual details of a situation, but just saying these are the sort of things we'll be thinking about. Also, we had a desktop with Julie and some other industry members, and one point made there is that the main reason that farmers and farm workers will be leaving their property if they have COVID, it's not because of any decision someone else will be making, it's because you'll need to go for your own health hospitalisation. So the best defence against that is vaccination. And we have people on the call. James is expert in that area. Emma is heavily involved in the rollout of vaccinations across our region. So if you have questions around that, then I'll be relying on them heavily as well. I do know that the latest or recent data from the United States, vaccinated compared to non-vaccinated, if you're vaccinated, or if you are not vaccinated, you're 11 times more likely to die from COVID, and you're 10 times more likely to be hospitalised. So best defence, if you want to stay on your farm, is to get double jabbed. Also, another thing that I might cover at a high level when answering questions, the response might be different if you're the first case in a region to be unlucky enough to have COVID, as opposed to if you're the 1,000th or 10,000th case in a region. And that's to do with the first case somewhere else. There'll still be a very strong focus on elimination. But once it's widespread in the community, then plans change. So it is a changing space, and we have updates on policy and practice pretty much daily at the moment. So I'll hand back to Julie now, because I think it'll be great to get stuck into some of the questions. Thanks.
Yeah, so hey, look, before we start, we're already getting questions rolling in, so don't be shy, put them in the chat box and we'll get to them as soon as we can. However, there are two things I would like to touch on before we start. Is following from what Michael has said, the medical officers or officers of health are with each DHB. So while Michael and the team today might be answering questions specific to their area, we generally think it'll be pretty accurate in a national context. And the other thing that I'm going to touch on now, because we probably don't want to touch on it later on, is we've had a number of questions re milk pickup and contamination from COVID-19. This is around the raw milk product, the processed product. Hey, look, your milk company is the best place to answer those questions. It's their area of expertise. And as you can understand, each company will consider everything relating to that when they're making commercial decisions. So talk to them if you want information on that. They are the experts. So now we'll get stuck straight into questions, and the panel will be here to answer them. So I will pose the question and it'll be up to the panel on who wants to answer. So here we go. First question: unless you need medical treatment, what reason would a farmer get tested for COVID? He maybe, if he's perfectly capable of still managing on the farm.
So I'll answer that for a start. So our expectation is that anyone that has symptoms that are consistent with COVID, and we know now that's basically any cough and cold, flu-like symptoms, we want people to get tested every time they have those symptoms. I myself have had 8 of these swabs since the outbreak. I do have 2 small children, so I blame most of that on them bringing home bugs to me. But the reason why we need that to happen is because it's important that we pick up early cases. What you've seen in the latest outbreak in Auckland compared to maybe what might happen in Christchurch. In Auckland, when they picked up that first case, it was maybe the 2nd, 3rd generation of spread already. In Christchurch, hopefully it was just the first spreaders. So if by some chance you are the first person to get COVID in our region, we want you to be tested. And that way we can shut down any outbreak. So that would be the reason.
Great, thanks, Michael.
Reasons. So if others want to chip in, then they're welcome, of course.
Sorry, thanks for that, Michael. Hey, look, one question we've got is, if you are able to isolate on farm because you're COVID positive, can you still work on farm?
Yeah, look, in general, if you're isolating on your farm, and what we'll be thinking about is stopping spread, obviously. So that's what we'll be coming back to. And it will be a case by case, but if you're able to convince us that you can carry out duties without spreading COVID to anyone else, then in theory, we'd say, okay, that's all right. Now, in reality, even if you're not hospitalized, there's many people are not going to be able to continue their work because they'll be feeling so bad. So that's one thing to consider. But if you are able to work and you're not going to spread it, then in theory, we wouldn't say you're not allowed to work.
So Michael, just carrying on from that, if I was found to be COVID positive and I wasn't, I was capable of carrying on, could I travel to my farm or to my runoff, which is 40 kilometres away?
Yeah, and this is a difficult situation, but we'd say no to that one. So if you're a case and you actually have to travel on public roads to do your work, then we'd say no, you can't do that, because if you happen to have an accident, you'll be putting others at risk. I know that it's rare, but it's still possible. So, you know, there could be some creative solutions to that. You may well, if there's no facility at all to work on the farm, then that's unfortunate. You won't be able to. But if you could hire camper van or something, that sort of situation has been done before. So it's those sort of things that may be considered at a case by case.
Great, thanks for that, Michael. Hey, we've got another one. This one's about vaccination. How do I have a conversation with my vaccine hesitant workers, and can I make them get vaccinated?
On the second part, currently it's not a requirement, as far as I'm aware, for farm workers to be vaccinated. So that's one issue. I should say there, it's not really my current area of expertise. I did used to work for WorkSafe. There may well be an argument that you could make that you wouldn't be able to make people get the test, but potentially you might be able to say there are certain tasks that they can't do unless they're vaccinated. But I won't go any further down that path, because that's really one for the health and safety experts. To the first part, yeah, open to ideas, but I think the best thing to do is to open the conversation and talk about perhaps why you were vaccinated. If you need further facts and information, and it's not always about facts and information for people, then there's a lot on the Ministry of Health website. But yeah, just trying to keep the communication channels open. And if people talk about why they haven't been vaccinated, then that's a good starting point. But sometimes asking them about that first off can also put up the barriers. So that's why maybe it's better to say these are the reasons why I did get vaccinated. But others might have something to say in this space.
Yeah, look, I think it's really tricky. I mean, people have multiple reasons why they have decided not to. I mean, I think it's good to have those discussions. I mean, what I keep coming back to is the huge amount of evidence supporting the effectiveness of the vaccine, the safety of the vaccine, and for both protecting themselves and for protecting others, and looking after others that other family or workmates. So yeah, I agree with Michael. I mean, I think there's a challenging conversations, but I think finding out why and then trying to point people towards good sources of information. And I think it's a universal truth that there's no good source of information on Facebook or on Twitter. So I mean, I think the Immunisation Advisory Centre that the University of Auckland runs is an excellent landing point to direct people to. The Ministry of Health also has some really good information. And if they're wanting something outside New Zealand, the CDC, Centre for Disease Control in the US, has some excellent public-facing information about the effectiveness and safety of the various vaccines, in particular, including the Pfizer vaccine.
It's Andrew here from Nelson Marlborough. James, you might be able to correct me if I'm wrong, but my understanding is that you know, the severity of your illness is much reduced by being vaccinated. Certainly the hospitalization rates and mortality look very, very favorable with vaccination. So the incentive, I would say, would be for those particularly who, sorry about that, those who particularly concerned about not being able to work and having to be leaving their farms, where if they had to go into quarantine or what have you, hopefully not, that would be a major incentive, I would have thought, for people to be vaccinated. So workers and the like, in terms of being well enough to continue to work, even if they were to become positive, as long as Michael said earlier on, you can maintain infection control, your effective infection control measures to prevent further spread.
Yeah, look, I completely agree. I mean, so the reasons for getting vaccinated are firstly to protect yourself. So there's about a 75–80% reduction in the risk of getting infected. If you do get infected, you're far less likely to develop severe disease. So the protection against severe disease, as Michael said, remains over 90%. So over tenfold reduction in the risk of needing to go to hospital. and a greater reduction in the risk of dying from the virus. So it's certainly the strongest protection you can provide for yourself. There's also, if you don't get infected, you can't pass it on to other people. And even if you do get a breakthrough infection, there's still there is still a reduction in the risk of passing it on to other people. So it's about protecting yourself, and it's about protecting others.
Yeah, sorry, I just wanted to add that many of the evidence suggests as well that somebody having an open discussion with their local healthcare provider, so it might be their local pharmacist or their local GP or their local nurse, and making sure that they air their concerns with somebody that they know, that they're familiar with in that health space. There's also a Healthline that they can contact if they would like to have a conversation. And we are also offering our immunisation coordinators to have a conversation with a workplace if needed as well.
That's great. I think you guys have covered that nicely. Another question, can you outline the protocol if a staff member becomes COVID positive or a close contact? What happens to the rest of us?
Yeah, so I'll start with, if one of your workers is a case, what happens is the local medical officer of health is notified about that very early on. So the first people that know the lab, so in our region, James and his colleagues, and then they all get in touch with us. We would interview the case and find out who they've been in contact with, and that determines who the close contacts are. And I think people are reasonably familiar with that and what that means. Then we would inform the case that they're a case, isolate the case. So if they're going to be still on farm, then we would assess their ability to not spread it further to anyone else. In general, that means living in a different part of the house if possible. If you've got other farm buildings, accommodation, then that would be excellent. And they wouldn't be able to continue to be in contact with people. Now, obviously, there are family situations where that is difficult or not possible, where you've got small children, or maybe in other complex families where there are other dependents. So that's the basic process. Now, if someone is a close contact, I should signal a change that is happening, and this is a situation with the case as well. The management will be different depending on whether they're double vaccinated or not. So that's another reason to be vaccinated. So for cases, there are changes afoot. They're not officially out yet, but we understand that it could be even today that the time for isolation will be shorter if you are double vaxxed. And for contacts, there will be different management as well. Already in the healthcare setting, there are protocols that mean that if you're double vaccinated as a healthcare worker, you can still continue to work, but you have to have appropriate masks and that sort of thing. Now, the close contacts, they'll also be contacted by someone from health. It's quite a complex system how we're managing this, because it's a national response. So it's not always the same person that will be talking to the case as talking to the close contacts. If you're a contact of a close contact, that's nothing. So often what happens is that people start to be concerned about that they're a contact, and it turns out they're a contact of a case. Now, in our mind, that's not a category. So there wouldn't be any impact on those people.
So Michael, if we had a COVID case on the farm, what additional steps should we take with the unvaccinated?
Well, I suppose even if you are vaccinated, so there's not a huge distinction at that point. The main thing is that if you are a case, you shouldn't be in contact with anyone, regardless of whether they're vaccinated or not. However, if you're not vaccinated, you're obviously at greater risk of adverse outcomes. You're at greater risk of dying, greater risk of being hospitalised. But just because you are vaccinated, that doesn't mean it's going to be business as usual. You won't be able to be in close contact with a case just because you're double vaccinated. It just means that if you're unlucky enough to be in contact, you're less likely to have adverse impacts. So if you're a case, it would be expected that you're not going to be in contact with any of your workers, and you even have to self-isolate from your own family as best as you are able. Now, in some situations, if we find that that's not possible and that there are other people in your household that are at risk, if they're immunocompromised, for example, then we probably would consider using the small number of accommodation units that we do have in the southern region, and other DHBs would probably be thinking along the same lines too. So there will still be situations where managed isolation facility or some equivalent, some motel or hotel rooms that DHBs have booked out might be the best place for you.
Okay, so can I pick up COVID from touching surfaces? And if somebody was COVID positive, what do we need to do to clean up before, or how long do we need to wait before we can go to those same places? For example, in the dairy shed.
I can maybe start with that. So I mean, initially we were really concerned about surfaces, but I think the evidence is pretty clear now that surfaces are really minor or very infrequent vector for transmission. This is, at the end of the day, it's an airborne virus, and it's by being in proximity to people who are infected that you're going to pass it on. With regards to air spaces, I mean, often that by the time someone's diagnosed, you've already been in contact with them anyway. So it's, in some ways, it's too late. But I mean, a dairy shed, for example, it's going to be extremely well ventilated, I would imagine. So it's not the risk of the virus hanging around in the air for any significant length of time and transmitting to other people is greatly reduced. So the risk is from being close to people, in proximity to people who are infectious. So if Michael or Andrew want to comment further on that.
Yeah, just picking up your point, James, that often it's too late for household contacts. So roughly speaking, in this outbreak, 50% of the household close contacts become cases. You're infectious before you have symptoms. So that's one of the reasons why that happens. And yeah, agree with everything that James has said.
Yeah, there is resource on the ministry site around cleaning. I mean, if, for example, the case had been using a farm vehicle, which was going to be needed for somebody else to use, we would recommend that that was thoroughly cleaned. So that it'd be common sense around the places where there may be, a higher risk. But as James says, it's primarily a airborne illness. There have been reports, as we know, of people contracting the illness via lift buttons and the like. But from what James has said, it's a sensible approach.
Thanks, guys. Michael, you mentioned before that if somebody was COVID positive, they should try and isolate in one part of the house. You then mentioned facilities, including motels maybe that have been hired that could be used for isolation. What would happen with a family situation where the husband and wife contracted COVID and there are kids involved that at the beginning certainly aren't COVID positive? Would they be separated, or could you stay on the farm and isolate, or would you need to be taken somewhere else?
So that's a difficult one, and the conversation would have to be had about options. If it depends on the age of the children, and in most cases, I think the family unit would be kept together in that situation. If you had mum and dad as cases, it's likely that the children have been exposed, almost 100% likely, unless for some reason they were staying with someone else at the time, and very high chance that they're going to become cases. it would be difficult, therefore, to ask someone else, even another family member, to look after those children, because they're potentially going to be exposed. But we'd have that conversation at the time with the family and just talk through those options. But it's quite common for family units to go into managed isolation facilities where those are available. So bearing that in mind, it would be common for whole family units to continue to isolate together at home. If for any reason those children were at high risk, if they were immunocompromised, then that would be where we would make efforts to separate with the parents' input, and I'm sure that the parents would be keen to see that too, and if there was a particular extra health risk for the children because of pre-existing conditions.
Thanks for that.
Yeah,
Hey.
the other thing I would add, Judy, to that is if you did have an adult who was a case and you were able to effectively isolate them in the same dwelling or in another farm, appropriately, farm building, then would be the ideal thing, or what you could, would be looking at separating out the case, even though, as Michael says, the chances are there's a pretty high hit rate when for family members to contract the illness in the same household. And but if you can avoid it, and it's not difficult to do, then we'd certainly encourage it, I would have thought. And because there is a complication, of course, that because you have your isolation period for your case, and then of course the quarantine period for all the family members starts when that person is no longer infectious. So they could be, so you've got the 10 days, and if they're staying and they're not effectively separated, there's another 14 days on top of that 10 days as minimum. And if somebody then gets it from one of those contacts, then you start all over again, reset the clock. So you can be in prolonged quarantine and isolation in those conditions. So it's probably, I don't know what James and others think of this, but I still think, unless you've got people, if you're getting negative results back on people at the beginning of them coming to light, to our attention, then I would try to separate them out as much as possible. But as Michael has said, it's not always easy to do that, and families do like to sometimes stay together. I mean, I've had recent families that have said, well, look, we're going to be in quarantine now anyway until after Christmas. We're working from home, so we're more than happy to stay, and they're aware of that, and that's the choice they make. And again, it depends on, again, what Michael has said, it depends on what other health issues family members may have, where we may advise actually against that, perhaps.
Great, thanks, Andrew. And I can see you're a very, very busy man. That's 2 shouts, by the way. Look, the next question, I'm actually going to say it in the way I think it was written, but how on earth do you get people to stick to the rules?
Oh, sorry, Michael, you go.
Well, actually, I was thinking that Pete might have something to say on this. One of the main reasons that people don't stick to the rules is because of welfare needs. If people have everything that they need, then they're much more likely to stick to the rules. And I'll just let Pete say something here.
Cool, thanks, Michael. So what we try and do if we do have to have someone isolating, and this is either if we have to shift them to alternative accommodation or if they are isolating in their home, because we still have a mandate to look after people when they are isolating on their home and making sure that they're okay. What we try and do, and we ask them when they do their daily phone call, is if they have any needs and if they're able to look after themselves. So that includes things like food, financial needs, animal welfare needs, and if they need, medication and prescription and or prescriptions and things like that. If they do flag any of those concerns or those needs, then we work through with a variety of stakeholders to try and meet those needs as best we can, to make sure people are kind of happy and as comfortable as they can. And we do understand that this is a pretty unpleasant situation to be in, and there's a whole bunch of other concerns going on, particularly in the farming sector where you've got cows to look after or the like. So if we can tend to those welfare needs as best we can, then that helps people stick to the rules. Now, if you do end up isolating, and we do ask you to isolate, please don't expect that we're going to bring you KFC and a slab of Spates every day in Southland, because that's not as far as we can go. We can basically do enough to kind of keep you happy and keep you well while you're in that period. And yeah, if we can meet those needs, then people are more likely to stick to the rules.
That's great, Pete. Hey, based on that, I'm not moving to Southland anytime soon.
Well, we don't supply Spates either, but where people do have the resources, we recommend a different beer. No, well, where people do have the resources, of course, they can do contactless deliveries. I know rurally it might be a bit more difficult, but people can drop things off. It's just about being contactless and not posing an infection risk from that. Would you agree with that, Michael?
Great. I've got one here, and I think this could run out to more than just commercial beekeepers, but quite specifically where commercial beekeepers, I'm going to go - rural contractors who go onto numerous farms in our day-to-day operations. How do you think this will affect us, and will we be banned from entering farms to access hives - cut, harvest grass? Potentially we're going to be in the busiest time of the year, so any hold up is going to be hugely detrimental.
So I don't anticipate those things stopping. All of those things are essential businesses. If a case is identified on a farm and it's a farm that a beekeeper has to access, we would be expecting that farmer to not be in a position where they're ever in close contact with that beekeeper, and I wouldn't think that would happen in the normal course of events, and we would expect that not to change. Same would apply for all or many of those tasks. If there were tasks that did require for some reason close contact, then those tasks could not happen. So a farmer who has a case would not be able to do any tasks that involve close contact with others. And I know that Andrew has touched on this, but that would include, we wouldn't want people to be using the same farm machinery immediately after a case, especially if it's a closed cab tractor or truck. But yeah, that's about all I have to say on that one.
Cool. So is the government looking at doing saliva tests, which farmers could have on hand on the farm so that they can get quick results and a quick turnaround? Being that, some of these farms are 1 to 3 hours away from a testing centre.
I might address this. So firstly, there's a bit of confusion in how this is talked about in the media. So the saliva test is essentially the same as a nasopharyngeal test. Use the same method, has to be done in a laboratory. It's just a difference in how the sample's collected. So I think what the person is getting at in the question is around more the rapid antigen tests, because those can be used potentially at the point of, can be used at home and have been used as such overseas. Currently, the ones that looking around the world at what's available, the ones for saliva don't perform very well. So most of them require you to stick a swab up your nose, but it doesn't have to go that far. And not particularly unpleasant. So I think probably we're going to increasingly see more rollout of rapid antigen tests, and they're already being used by some businesses, and hospitals have been piloting them, and they're being used in MIQ facilities as well. They're not generally available more widely just at the moment, but I don't think that'll be particularly far away before they're more generally available. In Australia, they're available, for example, in the supermarkets at the moment. I think if you're not in an area where there's circulation of virus, there's not a lot of point in using them at the moment. but I think they will obviously change once the virus is circulating in the community. So I think that's something to keep an eye out for. And I think they could certainly have quite a good role to play in the rural sector where you are removed from medical and laboratory services.
Thanks, James. Hey, another question that's coming through, and this one's coming through loud and clear from numerous people. If I am COVID positive and I am required to isolate at farm and not isolate at home, and not work on the farm, or I'm too sick, who is going to look after my animal welfare out on the farm, and who's accountable for this?
Well, so this is a question that was raised at a desktop exercise. It's certainly one that rests with the farming industry, so I'd let Julie speak to that, or if there's anyone from MPI or that sort of organisation.
Yeah, look, and I did want to pose it to you from a industry point of view, or from a legal point of view, the responsibility for animal welfare sits with the owner of the animal or the person in charge of the animal. So the industry working group is working really hard to pull together across the sector, using local solutions for local people, a way to make sure that somebody can come in and look after your animals if you're unable to do that. We're working really hard. There are going to be RSTs involved in this. There are going to be local people, the councils, all the industry bodies, Dairy NZ, Beef and Lamb, Federated Farmers. We will all be a part of that, and we are just working through that now. So it won't be an easy one, but forward planning, it really is the key to that. If you know somebody can step in and help you if you're in trouble, then that's the way to do it, because they're going to be familiar with your systems. Otherwise, like I say, we've created a very easy summary checklist, which can be used, and that just helps somebody else understand what your systems are, where to find things, and hopefully we'll never need to use them. I can't see that happening at this point, but hey, look, we can live in hope. Next question.
Oh, can I just reinforce that, Judy? I think that's really wise. In emergency planning, you always looking, you're trying to manage the issues well in advance and have a plan in place. And my understanding of the rural sector is it's usually a pretty close-knit community. And I think, having that network and understanding amongst farmers and what they would do to support each other in advance of this happening would be, well, it's a valuable work to do at this time.
Yeah, great. Thanks for backing me on that one, Andrew. Right, next question. Is it rude to ask my staff if they are vaccinated, or is it legal? What rights as an employer do I have?
So this is another one that sits with the health and safety legislation, so I can't speak to the legalities. But what we're trying to do here in our DHB is that it should just be quite a normal question to ask, and I think that's where we have to get to in society. It just shouldn't be seen as a particularly invasive question. It should just be a BAU question. Now, whether they are obliged to tell you or not, that's when it becomes a legal issue, which I won't comment on, apart from that I would doubt that currently farm workers would be obliged to tell you. But once again, that's one for the lawyers. So by all means, I'd encourage people to have a friendly conversation and ask.
Thanks, Michael. I have got 3 questions that I'm going to roll into one so that they can be answered at once. So is the quarantine time shorter if you're double vaxxed? and what's the time frame that you're contagious. And how long does it take to become clear of COVID?
So to the first question, we believe that there are changes going to be made today to the different times of quarantine if you are a case, or isolation. So my understanding is that it will be shorter for double vaxxed people, but I'll await the details of that today. So the answer to that is almost certainly yes. The other questions I might pass on, James might want to answer those, but they do vary by the individual. So you might want to repeat them, please, Julie, the other two parts there, please.
Yeah, how long does it take before you're actually clear of COVID? And how long are you contagious for?
Yeah, so as far as, well, if we're clear of symptoms, I mean, most people are going to improve in a, so the majority of infections are mild, and people will improve in a week or so. The concern with COVID is there's a significant minority of infections that get worse, usually in the second week, and people progress to becoming quite unwell, can rapidly deteriorate, need oxygen therapy and support in the hospital. And so that tends to happen a little way down the track in the second week of illness. And then people can be in hospital for many weeks. If you make it to ICU, the median length of stay in ICU is over a week. There's also a significant proportion of people who have ongoing symptoms. So about a third of people have, I mean, it varies, different papers have made different estimates, but I mean, it's roughly about a third of people have ongoing symptoms that can last weeks to months after COVID, and that can be anything from a mild, such as a loss of smell, loss of taste, through to ongoing significant shortness of breath and cough, and neuropsychiatric side effects such as depression and brain fog and the like are also quite commonly reported after COVID. They're more common if you've had more severe disease. So the COVID can have a very long tail. As far as contagiousness goes, most of that transmission is going to occur within the first week, and from a laboratory perspective, we can really culture the virus after the first week. But I'll let Michael or Andrew talk to the public health restrictions, or when you're considered, the period of time which you're considered contagious from a public health perspective is slightly more conservative than that.
And currently, we've got a situation for the Auckland outbreak where you have a minimum of 10 days, if you're a case, 10 days of being isolated away from everyone else, and the last 3 of those days at least, so you have to have 72 hours of having no symptoms. That's the minimum. And from what I've seen and heard, most people still have symptoms at that point, so most people aren't getting out on that 10th day. Although I should say that nationally, and this is probably going to be the case if we had a case in Southern, nationally it's actually 14 days. They've just shortened it. Well, in Auckland they're using 10 days because of a local decision made there based on the context of the outbreak. But down here and the rest of the country, it's 14 days from onset of symptoms and 72 hours symptom-free at the end. That's not added on to the 14 days. That can be within the 14 days, so the last 3 of those 14 days. And if you are someone who's never had symptoms, and some COVID cases never have symptoms, then we do 2 days prior to the test. So either 2 days prior to the onset of symptoms is when you're infectious, and we'd take the date of onset of symptoms as your starting of that 10 days in Auckland or 14 days elsewhere. and the test date, if you never have symptoms, would be the dates that we would go by for that, either 10 days in Auckland or 14 days elsewhere.
Great. Hey guys, we're just hitting 1:20 and the webinar is due to close at 1:30. So I'm gonna do some quick fire, quick answer questions to you. So the first one is, do centres for testing centres and MIQ have translators available so people can speak in their first language?
Yes.
Excellent.
I'll add to that, Julie, all the contact tracing, if they do need a second language, which was asked in the initial questionnaire, if someone says, yes, English isn't my first language, then there's a pool of people available, or it's done through like the same hospital telehealth services.
Excellent. Thank you. Are you aware, actually, I'm going to reframe that. I'm sure you're aware that there are many people that have no intention of being tested, knowing what they will have to go through, especially with what is considered a bureaucratic process that will put their potentially animal welfare and farms at risks. How do we change perception and messaging around this so that people aren't afraid?
Well, hopefully those broad messages that being positive doesn't mean you're going to go into a managed isolation facility in the vast majority of situations, I would think, because farms have that natural isolation anyway. That should help. And two, the work of planning for, if you are a case, other people helping, because as I say, the main reason why you're going to need that help is being hospitalised rather than actually being diagnosed as a case.
Awesome. Right. Another quick fire question. This has come up a number of times. Can I ask my contractor coming on farm what their COVID and vaccination status is?
Well, of course you can ask. Whether they're obliged to say, they're probably not, but that's once again a legal question. Now, I don't know how many options you have, but if a contractor doesn't tell you, perhaps there's a contractor that would tell you the double vaxxed, and you could always choose to use them instead. Yeah.
And what can I do to minimise the risk of contractors when they come on farm?
Minimise the risk if they happen to be COVID positive. Well, the basics are to keep your distance. So that is still probably the most effective way of not getting COVID, is to never come in contact with someone who is COVID positive. And more detail, indoor settings are always more risky than outdoor settings. If you have a mask, and if they're willing to wear a mask, then that is also good protection. But keep your distance, wear a mask, outdoor meetings if possible, don't share the same indoor confined spaces. If they're symptomatic, if anyone has symptoms, then stay away, don't go to work. If a contractor turns up and obviously looks unwell, then send them away.
When we assess how close a contact is, or categorize contacts at a workplace situation, we also look at, so basically some of the things that Michael's talking about is we look at shared facilities, so shared tea rooms, toilets, other things. So, you know, where you can minimize the contact in those environments as much as possible, that's important. And obviously the usual sort of, you know, just social distancing as much as you possibly can in the workplace, mask wearing and the like, hand sanitizer and hand hygiene facilities available, the stuff you'd expect to come across and use in that regard.
Yeah, so following on from that, we've got a large farm situation where a partner of one of our staff travelled into a level 3 lockdown region and visited a location of interest. The government has advised to monitor for symptoms and not to isolate. How do we treat this? So is that where we minimise those risks like you've just spoken about?
Yeah, well, this is where you start to cast a net quite wide if you go over and above what the Ministry of Health advice is. Now, you are welcome to try to do what you can and go over and above. If you asked a public health unit, or if you asked for my opinion in situations like that, I'd go, well, just stick with what the Ministry of Health has advised. If we start going beyond that, in a situation where many people are affected, it starts to grind things down to a stop. So, yeah, if that's all the advice they've been given, then as long as they follow that, be vigilant about symptoms, as everyone should be, then that's probably appropriate in that situation.
Right, I'm gonna finish with one very specific farming question to end on. Are you aware of any research that suggests that cows and sheep can get and transmit COVID-19?
I'll have a crack at that one. No, but we know that some animals certainly can. So we know cats and dogs and tigers have been reported to be infected. Also, the mink industry in Scandinavia. So I wouldn't. It's entirely possible that they can, but I haven't heard of any reports to suggest that sheep or cattle can receive it, can get infected from humans. But that, yeah, can't exclude it.
Great, you guys are answering these so well and so succinctly that I'm going to chuck a couple more in here. You mentioned, Michael, that if you're a COVID positive case, you can't travel on a road 40 k's from your farm or any distance. Would that apply to a public road that is my farm boundary?
Yeah, these situations are going to be have to be discussed case by case. So I'm probably not in a position to say in that particular case what would happen, but the principles that we'd be using, if you had an accident on a public road, even if it is your boundary road and other people are using that road, and you are a diagnosed case, would you be putting others at risk? I mean, the same could be said even if you're a farm worker on your own farm, but what we could do there is probably put in place situations where others would know, if you had an accident on farm, they'd already know that you're a case. If emergency services come across you on a public road, they wouldn't necessarily know that. So that's the principle, that's the reason behind why we would say, no, you can't use public roads in general. Now, there might be a case by case example where it's okay, but I wouldn't think so. I mean, being a case is quite a thing. If you're a close contact, maybe allowances could be made, but an actual known case, I don't think that we'd be keen to be making those sort of allowances.
Great. One more, in a dairy context, for example, 60-barrel rotary shed running 2 teams with the view that if one team went down, the other team could continue, and only one team is in the shed at a time. Is that the right thing to be doing?
Look, I'd say at the moment, depending on where you are, it could be the right thing to do. I mean, if it wasn't adding a lot of farm cost and inconvenience, then by all means, it's be certainly the right thing to consider when COVID is circulating in your community. And that's what a lot of businesses are doing. They'll have plans that they'll put in place at alert level 3 or 4, where the situation is you've got COVID circulating. Just some things to watch out for. Businesses might have really good processes, but they might forget about lunch breaks or what happens outside of situations or in cafeterias. So just keep all of those places in mind too. And we'll be asking questions about any possible breaches. So while they're doing the work, it might be fine, but then they might all share at the end of the shift and starting of a shift the same areas.
Hey, I'd like to say, I'd like to summarise now. First, I'd like to say thank you to our panellists. You guys have been wonderful, and to thank you to everybody who's attended this webinar today. I hope you found found it informative and that you've had some of your questions answered. Those that we haven't been able to get round to, we'll endeavour to have a Q&A or frequently asked questions on our website and along with this webinar, hopefully this afternoon. And as I said earlier, if you have any questions at all around milk pickup, please contact your milk company. So have a good rest of the day and thanks for attending.